So my name is Dr. Simba Makuni. I'm a certified travel medicine practitioner, and today I'm going to talk about yellow fever. And in my discussion today, I want us to understand what yellow fever is, understand how it is transmitted, where it is found globally, and also get to know how to prevent yellow fever, both the vaccine and the non-vaccine related prevention strategies. And in terms of the actual vaccination, I'm also going to talk about how to actually carry it out effectively and safely. And lastly, but not least, also we're going to look at the potential side effects of vaccination. So what is yellow fever? So yellow fever, this is a viral hemorrhagic fever that is caused by a virus, and it's transmitted mostly by daytime mosquitoes that are found in mostly sub-Saharan Africa, Central and Southern America. Also, it's important to note that it's also endemic in monkeys. So there are some monkeys which actually have this yellow fever virus, but it's asymptomatic to them. The epidemiology, I think I spoke about it before, but this is mostly sub-Saharan Africa and also Central and Southern America. So these are the countries where yellow fever is most prevalent. So I just want to talk about the mode of transmission. So remember, I spoke about how this virus is found in mosquitoes, and there are types of transmission that can occur. So there is what we call incidental transmission, whereby you are in an area where there is yellow fever in the mosquitoes, and you actually happen to be in the jungle or camping or things like that, and then you are bitten by a mosquito that has got yellow fever. So that's incidental. And then also there are some areas in some countries where they have got yellow fever, where now they are what we call transitional zones. Basically, we are saying that these are people that are staying in the peri-urban areas where there is a transition between the jungle areas and also where humans stay. So that's a transitional zone. So the mosquito can either bite, it can be using monkeys as the vector, or even the humans. So you can actually be bitten by a mosquito in that zone. And then also, let's say someone has been in an area where it's endemic, and they're actually bitten, like what happens with malaria. But let's say they are bitten, and then they come back to an urban area. And within that urban area, we have mosquitoes that are actually just biting, looking for that blood meal. So the yellow fever can also be transmitted that way. And this is one of the biggest concerns in terms of public health. This is why a lot of countries are putting restrictions in terms of travel, the vaccination, requiring this, because you can actually be bitten in a country where there is yellow fever. You come back, and then the local mosquitoes can actually now transmit the yellow fever. And I think in certain countries there are aggressive types of mosquitoes, the Aedes type, that can have numerous blood meals. So if someone comes from, they are bitten, they come, that kind of mosquito can have multiple blood meals, and it can actually be spreading the yellow fever virus in that manner. So how do we know if we have yellow fever? Supposing you go to a country and you are bitten and you've got yellow fever. So 90% of the times, this is just mild flu-like symptoms. So, and people who are endemic to that, people that live in that certain area, will probably just have mild symptoms, flu-like symptoms. But there are a few times where now you can actually have serious illnesses, and the serious diseases it's actually mostly in tourists. So let's say you have traveled to an area where yellow fever is endemic, you get bitten, you get the virus. So we are saying in most of those cases, you can actually present with severe illness. And the symptoms that to watch out for there are a fever, hemorrhagic fever, which is normally fatal. And then the incubation period that we have is 3 to 6 days. So from the time that you get infected to the time that symptoms start to manifest, there's an incubation period between 3 to 6 days. And the highest, your most infective or the highest viremia is actually shortly before the onset of the fever. So on day 5, we are saying before you have any symptoms, that is the time that you are at the highest level, that the virus is at the highest level in your body. And that's why other countries, if you travel to a yellow fever endemic area and then you want to go to another country, some countries can actually put you in quarantine for like 6 days because they know the incubation period. Let's say you don't have proof of yellow fever vaccination. And the highest case fatality ratio is in unvaccinated individuals. So if you haven't received the yellow fever vaccine, this is your chances of actually dying from this is quite high. And there is no cure. So there is no cure for yellow fever once you have the disease. And in terms of diagnosis, the serology tests are unreliable. And then there's also a PCR test that can be done for yellow fever virus. But remember, the symptoms are mild, they are flu-like. So sometimes it's difficult for doctors to diagnose this in Zimbabwe, because I think currently we are not even able to do a PCR for yellow fever in this country at the moment. So I just want you to see that this is not something that is out of this world, that we actually have yellow fever around. So I was just looking at one of the sites that gives us information. I think you can see. So you can see that from the past 3 months, from August the 28th, we have had cases in the world in terms of yellow fever. So you can see the first slide there, you can see in Ecuador, they had 8 confirmed cases of yellow fever, and there were 6 deaths reported. So you can notice that 6 out of 8 actually died there. And then in Colombia, they had a total of 125 confirmed cases and 53 deaths from yellow fever. And in Angola, which is actually closer to home, they've reported 7 cases of yellow fever yellow fever in Angola. So if you travel to any one of these countries and you happen to be infected by yellow fever, this is why people are talking about yellow fever vaccination, because we want to be able to prevent deaths from yellow fever. So, guys, if you have a question, I'll ask maybe at the end of the presentation. I'll also give you an opportunity to ask. So, in terms of prevention, I think let me first talk about non-vaccine prevention. So, why this is important is sometimes it is not possible to actually vaccinate a person. So I'm just going to talk about the reasons why at times we are not able to vaccinate. But for now, I just want to talk about the prevention that is non-vaccine related. So basically, one, you need to be able to prevent mosquito bites, because we know that this illness, you can get it through a mosquito bite. So the general precautions in terms of preventing mosquito bites are extremely important in any traveler. So basically, you can apply insect repellent. Also, you can treat your clothing. So clothing, footwear, tents, or supposing you're going camping, you can make sure that you can treat. There are some chemicals that we can use to actually treat the tent, your sleeping bag, clothes and things like that. Make sure you stay away from stagnant water. You can use things like mosquito nets, sprays, etc. And also just wearing sleeved shirts or trousers, and these ones, they actually are daytime mosquitoes. So remember, in Zim, we have mostly nighttime mosquitoes. You know that If you close your windows early, the mosquitoes are not going to bite you at night. But in this case, the mosquitoes are actually daytime mosquitoes. So you need to make sure that you take precautions throughout the day. And then now I want to talk about the vaccination. This is the main prevention that we are actually doing, and this is what a lot of countries are actually advocating for. So you have to be vaccinated, but the vaccination must be done by a center that is accredited to actually administer yellow fever vaccination. Why this is important is vaccine procurement and storage is extremely, extremely important. So basically, that cold chain is extremely important. And if you get a vaccine that has not been kept well, the chances of it not working are high. And then at the end of the day, you think that you are vaccinated, but you are actually not vaccinated. So we need to make sure that the way we store our vaccines is important. So when we receive our vaccines, I mean, as we do normally, we have to make sure that the temperature in the fridge is maintained at a certain level, because we want to make sure that that vaccine remains active. Even the cold chain, the person that is delivering the vaccine from wherever it's procured, it has to actually come in a proper cold chain that is actually traceable. And we can even trace even the batch of vaccine that we're actually giving, because it is extremely important. And vaccination must be done at least 10 days before travel. So this is not where you come and you want to catch your flight tomorrow and you say, please, can you just vaccinate me yellow fever? It won't work. You need at least 10 days for your body to actually build the immunity. So you are not able to just come a day before. And I've seen, in practice where people just say, look, I don't want the vaccine. Just give me the card. So I think a lot of people come to the center with those kind of requests, but they're just putting themselves at risk, and not just themselves, and they're also putting other people at risk, because remember of how this thing is transmitted by mosquitoes. So that's why in other countries where if you get vaccinated and they are not happy, or they suspect that the vaccine card may not be genuine, they can actually quarantine you for 6 days. So this is what I was talking about. This is because of that incubation period. So if you go to Angola, for instance, and you want to go to another country, maybe you've got a connecting flight, what they can do is, if you don't have yet proof of yellow fever vaccination, they can actually quarantine you for 6 days until they make sure that the incubation period is elapsed. So vaccination prevents against serious infection, and then it also helps to protect countries from outbreaks. So now that I've talked about vaccination and the importance, I'm also going to talk about the side effects of vaccination, so that we just have a balanced side. So yellow fever vaccination, this is like, the thing with yellow fever vaccination, this is actually a live virus that is actually being injected in a person. So it's a live virus that is weakened. So it's a weakened live virus. So just looking at some of the data, you can see that in terms of side effects of vaccination, the incidence of vaccine or yellow fever vaccine-associated neurotropic disease, it's 0.8 per 100,000 cases. So what we are saying is the times that you can actually have side effects, we are saying for every 100,000 people that have the vaccine, that get the vaccine, 0.8 can actually get the side effect, which is neurotropic disease. So 0.8, that's not even one. That's what? 0.8 per every 100,000. Yeah. And then case fatality for the above is also less common. Okay, so there is the incidence of the disease, and then we are now saying case fatality for that is actually less common. But I want you to notice something. This increases to 2.2 for patients that are above 60 years old. So for anyone below 60 years, we are saying it's 0.8 per 100,000. But it increases to 2.2 for people that are above 60 years per 100,000. And then there are two types of serious side effects of it. So there is that neurotropic disease, and then there's also the viscerotropic disease. And its incidence is actually lower at 0.3 per 100,000 cases. And it also increases to 1.2 for people that are above 60 years per 100,000 administrations. And case fatality for this one now is about 50%. So these are some of the figures that we have. And just to balance that up, if you look at the disease risk for yellow fever per trip to Africa, so I just want to balance the side effects of vaccination versus the side effects of actually getting the yellow fever disease per travel. So you can see that it's for travel in Africa, it's 50 per 100,000 travelers. So we are saying that side effects, depending on your age, it's 0.8 per 100,000, or in some cases 0.3 per 100,000. But the disease risk per trip, if you are going to Africa in an area that's endemic to yellow fever, the disease risk or it's 50 per 100,000. So basically, there is more risk of you getting the yellow fever and having getting the yellow fever disease than it is for side effects. That's what we are just trying to push on that point. And then in South America, it's 5 per 100,000. So you can see both figures are well above the side effects. So remember, this is a live virus. It's a live virus. And hence, there is also that risk that we're talking about. So a proper pre-vaccination assessment must be done. This is not the kind of vaccine that you just walk in, get it, and just leave. Because we are saying that there should be a proper pre-vaccine assessment done. And I think one of the key things is the aspect of immunosuppression. And you know, in Africa, we have things like we have HIV. So some of our clients might actually be on HIV treatment, and we need to make sure that before we vaccinate, we need to make sure that the immune status of that patient is actually good enough to receive the vaccine. And then also some cancers like leukemias. So sometimes patients might actually be on treatment for leukemia and they come through for vaccination. You don't just vaccinate, you have to make sure that the patient is actually able to receive the vaccine. Also things like allergies. So if you've got an allergy to eggs, you can't just take the vaccine. And then there's also things like thymectomy as well. You can't just take the vaccine. Also, I think the age, if you are less than 6 months of age, vaccination is a contraindication because your immune system is not yet matured enough. Or even in a previously unvaccinated individual that is 60 years and above. And I think that previous slide actually showed how the risk increases because of the age. But you know, in clinical practice, patients come in, they're just vaccinated. People never really, here I know we do proper assessments, but at times people might not even ask someone's age before vaccination. But we know it's actually a risk factor. And then the vaccine actually lasts for 10 years when you get it. And then these are just the contraindications. I think I did speak about these but maybe just to list them as well. So basically, another one is anaphylactic reaction. So, Aisha, you can't even read that. So, supposing you've had a previous reaction to vaccination in the past, it's also a contraindication to vaccination again. Also, remember the age. If you are less than 6 months of age, it's a contraindication because the vaccine can actually produce an encephalitis as well in children. Women that are breastfeeding and the child is less than 9 months, it's also a contraindication for vaccination. And any person that has a reaction to egg protein and things like that, again, it's also a contraindication for vaccination. And then I think my last slide, I think the last slide is just talking about immunosuppression. And I think the most important one there for us is the aspect of HIV and AIDS. We are talking about making sure that the person that you are vaccinating, the CD4 count, is more than 200. Or if it's a child or is less than 15% of the total lymphocytes in children aged less than 6 years of age. So this is my presentation. So now I'll just open this up so that we can just have some questions and I can answer. Yes, you can go ahead, Mr. Namoreno.
I wanted to know, like in our case, we have yellow fever in stock.
Yeah.
And we've been having some clients asking for that yellow fever. So should we ask them to go and prepare it from somewhere else? Because there's this cold chain should be maintained.
Yes. So I thank you so much for raising that point. So sometimes a patient can actually come holding a yellow fever vaccine and saying, please, may you vaccinate me. So we cannot do that because we don't know if the cold chain has been actually maintained. We don't know how long, they buy it, they keep it in their car, and it's a challenge for us. But I know we've been having a challenge of vaccine availability in this country. And I think we've been engaging the suppliers to say, may you please supply us yellow fever. So I think that's something that, and I hope we have some suppliers listening, we really need to have yellow fever vaccine in the country. Yeah. And I think in Zim, we also have a challenge where there are some unauthorized sources of yellow fever. And I think that's where a lot of practitioners are getting it. And I think that's actually very risky for the country. All right, any other question? Yes?
You said they have to know the patient's CD4 count. What if the patient doesn't know their status?
Yeah, so I think if they don't know their status, that's why I think we need to do like a pre-travel consultation so that we can actually do a consultation and kind of see if there's anything pointing to immunosuppression. Because sometimes you might not know your status, but there are certain clinical signs that when you have a consultation with the doc, we can actually suspect that there might be some immunosuppression. So this is, especially if someone's HIV status is known, then yes, let's know the CD4 count. But if they don't know their status, that clinical examination can help because the doctor can pick one or two things that might prompt them to investigate further.
So meaning, if they know their status, we have to collect samples to check their CD4 test.
Yes. But in this country now, because if you go to clinic, why? They just give the vaccine. And now if you say to someone, no, we need to do a CD4 count, we need to do this, they'll probably just go elsewhere. But this is what we need to do, because if you do it and the CD4 count is low, and that patient then has that side effect and dies, then it's actually a much bigger issue. That is why world over, for you to be able to administer yellow fever vaccine, you need to be accredited. You need to have learned how to actually administer the vaccine. You need to make sure that you know, because a lot of practitioners might not even have this information. But I think that's a really good question, and yeah, that's why I think here we only have one person that does vaccination, and we have like a proper pre-vaccination assessment that we do, before vaccination, because of that. Any other questions? Yes, Doc.
For those who have those contraindications, and they still need to travel, what do we provide them with? Do you write a letter?
Yeah.
Okay.
So if someone has got a contraindication like what we mentioned, then we can actually write a letter to the receiving country to say, this patient cannot be vaccinated, and we provide that letter. And I think there is a specific standard that we have of that letter that we can use. And this is where now the non-vaccine preventions now work. We now make sure we enforce that the patient must make sure that they don't go to the jungle areas, they use repellent, all those things to prevent that. You can ask.
If someone loses their card,
yeah. Yeah.
What?
Yeah.
Do you advise they get vaccinated again?
Yeah.
What's
the best? Yeah, so I think because we know that the vaccine is there for 10 years. So because I've seen patients that can come to us saying that I was vaccinated there, but I lost my card. So it's difficult for us to write a letter when something that we don't know. But because we're an accredited center and we keep these records, we will be able to check to say, okay, if you came to BMC and we vaccinated you, we would have the record to say this patient was vaccinated. And then we can actually even issue another card. Because it's just a card, you just need the details.
We don't issue the cards because
it's one. So maybe we'll just give them a letter.
What we have been doing is we confirm in our records that we have given the patient the vaccine. Then we just write a confirmation letter and confirming the date.
Okay. Okay. Okay, that's fine. And I think because we have the records, we know which batches. So if there is a problem, even internationally with the batch, we are able to trace that. Yeah. Yes, Mr. King.
Maybe on the same aspect, I was then wondering whether there's some element of global connectivity.
Okay.
So that if in Zimbabwe, maybe one has gone to one country, you was vaccinated there, if there's some kind of traceability, connectivity, so that we get linked to that country where the vaccine was vaccinated before, and we get also information.
Okay. So I think currently, internationally, I think this is only just coming to Africa. But travel medicine, it's like a whole different field where there are these collaborations and there are tools and resources that we use collectively. And we are also part of that network. So if someone goes to, let's say, Tanzania, for instance, and comes back, if I needed to know some information, there are also some travel medicine practitioners that we are actually in community with. So I think now, even in Africa, this is now starting to really come up, because we now understand. Today I'm just talking about yellow fever, but there are many other diseases that can be transmitted via travel. So that one is actually coming, and it's actually I wouldn't say coming. It's actually there, but probably not all the countries. But in Africa, we have started as well. Yeah. Any other questions? Comments? Yes, Doc. Yes, you can see through.
So for patients, for travelers, maybe those who have come to Zimbabwe and yeah, they present to us different whatever conditions. Should we also, I know we should we also book them for so that we can see them for advice or what?
Oh, yes.
Yes, because I've been seeing patients come with, come from Australia, then they come to Zimbabwe, starting having diarrhea, etc. So there's some information maybe which they might want to know about travel, etc. And the different diseases across zones. For some will be traveling
Country to country.
Countries come from Zimbabwe, they go to this country, to that country. So for that detailed advice, should we have a procedure, maybe saying if you see a patient, such a patient, let's, if they are still in Zimbabwe for some time, let's move them so that maybe you can see them, give them advice. I don't know.
Yeah, I think that would be that would be good because especially not even the ones that are coming in, even the ones that are traveling out as well, because that's the whole essence of a pre-travel assessment, to say, okay, you're going to this country, please be aware of this and that. And if you have any problem within that country, we have practitioners X, Y, and Z in Nigeria that are accredited that can actually assist you. So I think it's important, but I think what the problem that we've been having in Zim is people don't kind of realize the importance of a pre-travel assessment. So a lot of the patients that you're talking about that are coming from Australia, probably before they travel, they've actually gone for a travel assessment. So when they get here, yes, if I would love to see them as well. But we've had a problem where patients are generally not, what can I say, don't see the value in a pre-travel consultation. Yeah. But even if someone is sick and they're in emergency, any doctor can attend to the patient as well.
Yes,
for emergencies. This advice, yeah, I think this one is critical.
Yeah, for emergency,
We can do. Yeah, no, I would love to see the patients. I mean, I think that's why I'd done travel medicine, just to focus on the travelers, for instance, yeah. Because sometimes, it's now a global village. I think we saw with COVID. So there are other things, like now people are talking of monkeypox, chikungunya. There's a lot of things that can be happening, and I think that would be good. Yeah. Yes, you can ask.
So are we saying every patient who comes for yellow fever gene should have a pre-travel assessment first?
Yeah, that's what we do. So yeah.
This where we have some few questions, like a questionnaire where the patient completes and tells us, and we also obtain the consent for us to administer the yellow fever.
Okay.
So from this patient, we can identify risk factors and advise accordingly.
Yeah. So yeah, any patient is able to do that. And now what we've done is we've now also gone digital. So the patients can actually, on their phone, they can actually download that FlexiDoc app. And then in that application, they can actually select that they want to book for a travel assessment. And then that form that we had physically, they can actually complete it online. So they can complete all the information, all the history that we asked them there online. And then when they just come here, that information is already available and then we then complete the assessment. So that's now available on Apple or Play Store.
The only problems that we are facing
Okay.
is the fact that most of these travelers just come for the vaccine. Do you have the yellow fever vaccine? Yes. I need it. How much is it?
Yeah.
Then we tell them, when you now take the history and everything, you find the client is traveling maybe in 3 days' time.
Mm.
Or some even say, I'm traveling tonight.
Tonight, yeah.
You know. So we have not stopped them from getting the vaccine, but
Yeah.
we have informed them that they are not yet covered, because rightfully they should get this vaccine at least 10 to 14 days before they go to the area.
Yeah.
So they should take these precautions we talked about. And we also tell them about the possible side effects, and what to do.
Yeah. Yeah, it's interesting. Unfortunately, that's what happens with patients. And because of the travel assessment, you can spend maybe 30 minutes on a client. So, so it's because you want to do a proper pre-travel assessment. So, yes, that's what we are doing. But I think we still need patients to be aware of the importance of that. Because the client will just say, you guys are taking too long. I should just, if I go there, it's 1 minute, I'm done and I'm out. Yeah. So you had your hand up. Mama, you. Oh yeah, you had your hand up, yes.
So I just wanted to ask if we can probably organize another training on pre-travel
assessments, yeah.
So that at least maybe our nurses and also our doctors will know what to do.
Yes. Yeah. Yeah, no, I think that's important. So I was actually thinking that maybe the yellow fever talk, this is just the first aspect, but we also have to talk about now the pre-travel assessment, what's important, and then because there are several key topics that we also have to cover. But I think that's a really good idea. Yeah. So are there any other questions, or now you know about yellow fever? Now we all know. Yeah. So if a patient comes, or if it's we now know that this is yellow fever. It's not very common, but when it happens, it can actually cost a life. And unfortunately, because it's not so common in Zim, we might not even be able to diagnose it until it's too late. So I think let's make sure that we take all the precautions. And as we always say, that human life is what? Is sacred. And it is our duty to safeguard that. So whenever a patient is coming, you are the frontliners, you see them first. Please, let's advise them accordingly in terms of yellow fever vaccination. All right. Thank you, guys. Thank you for coming.
Sorry, I just want to raise one point.
Okay.
Since I've noted that you are there, the CEO, the matron is here, the doctor is here, and also the receptionist is here. It's got nothing to do with the yellow fever vaccine.
Okay, that's fine.
It's something to do with the medication.
Okay.
I've been having incidences of clients who just go straight to the pharmacies and they buy their medication. And then they bring their medication to our clinic. Then they say, this is an injection. We wanted to know how we handle those cases without offending clients. Like, was it just a choice of business?
Okay.
We got a client who went straight to the pharmacy and told the pharmacist that no, I did not give him some tanzans. And then they sold him the Rosephine and the oral medication. And when he came to the clinic, we refused. I was the one who was on duty. And I said, no, this is an antibiotic. The doctor should prescribe this. Where's the prescription?
Yes.
And he just said, no, I just went straight to the pharmacy and they sold me this process. But I refused to give him that.
Yeah. Yeah.
So I just wanted to know how basically you
Can you tell?
without offending the clients.
Yeah.
Because they wanted to bypass the consultation.
Oh, yes. Yes.
They're trying to bypass the consultation thing, then they go straight to the pharmacy and they
Get the medication and yeah, I think it's also the same as the vaccination, for instance. People don't value the consultation. You know, they just feel that if you just give me the medication, I'll be fine. I think it's just it's a cultural thing where people are looking. They don't value they just want the medication. So I think we just have to stick to our principles to say, look, we cannot administer. And I'm actually uncomfortable with administering medication that is not purchased here, because you don't know what is actually in there. So I think that's one thing, and I think that's a policy that we probably need to implement, to say if someone is coming and they have their own injection, we don't know what's actually in that injection. You know, we just don't know. If you administer it and then there is an adverse reaction, we are stuck. And at the end of the day, it's us, because people will say, but why did you administer this? Did you actually test and see what it was? This the actual drug that's in there? So I think that's one thing that we really have to be strong about. No, you know what? Let's administer injections that we've prescribed. In the cases that maybe we don't have an injection and then we write a prescription to someone and then they go and buy and then they bring it, I think that's a different scenario. But I'm talking about the scenario where someone just comes, walks in with the medication that and says administer.
They go to the pharmacy straight.
Yeah.
Usually come with the prescription from the Adams.
Yeah.
And you are more on the price.
Yeah.
So they come for the second check.
Yeah.
Those ones can give.
Those ones are
But
fine.
if any issues with those ones who go straight and purchase pharmacy.
From the pharmacy. That's even if that's even if they purchase it from the farm. They can even purchase it from somewhere else. You won't, from the street, you won't know. Maybe they didn't even purchase it at the pharmacy. Maybe they purchased it in the street. And when he comes, he just tells you, I got it from the pharmacy. So I think without prescription, I think we have to stop that. We have to make sure that we are just resolute and firm. And I'm happy that you were able to tell the patient that, we can't do this.
The doctor did
Prescribe. Yeah.
At one time, one bought a yellow fever vaccine from our pharmacy, but now I didn't know. Saka akangouya achiti aitoti mainjection tikuda yellow fever. Rakanga risiri ice, risiri kana chakangobata. I can't give you kuti andizive kuti magara naro rapa chifo auno. Ndisingatozivi kuti from our pharmacy. Saka akazouya tepura chiti saka imi makuramba ndikatekesera tunhu makuramba kupangati ayo imi munozviziva mamupire irisiri mwaisi.
Yeah.
We don't do that.
Yeah. But when that happens, someone thinks, these guys want to make want to make money. So you see, that's also where you're looking at the cost of yellow fever vaccination, to say we are doing a pre-travel assessment and vaccinating. So the cost is definitely going to be higher than if you just get the vaccine. So people just kind of think, no, this just vaccinate, which is a problem. Yeah. All right, so I think that's fine. It's 5 minutes to 10. So I enjoyed the presentation. I love the fact that you guys were interactive. And I'm just hoping that we are going to be able to implement this. I'm happy that we've recorded this so that even in future, the guys that haven't watched this, it will be available on YouTube. So they'll be able to watch the presentation in future. Thank you guys and have a good day.